Mastering Pediatric Assessment and Vital Signs. Introduction to Pediatric Assessment. Welcome to Pediatric Assessment and Vital Signs. What is pediatric assessment? It's a systematic approach to evaluating a child's health. It involves observation, measurement, and hands-on examination. Why pediatric assessment matters. It detects abnormalities early. It helps determine appropriate interventions. It guides parental education. It establishes baseline health data. What makes pediatric assessment unique? Children are not small adults, they have different normal values. Assessment techniques must be age-appropriate. Building trust and reducing anxiety is essential. Principles of pediatric assessment. Successful pediatric assessment requires a thoughtful approach. Key principles. Start with the least invasive procedures first. Begin with observation before hands-on examination. Use a child-friendly approach with calm, reassuring communication. Adjust techniques based on the child's developmental stage. Involve caregivers to help reduce anxiety. The order matters. Observe the child from a distance first. Perform non-threatening assessments early. Save uncomfortable procedures like ear and throat exams for last. General observations. Before touching the child, observe carefully. Appearance. Is the child well-nourished or underweight? Does the child appear alert or lethargic? Is there any obvious distress? Behavior. Is the child crying, irritable, or calm? How does the child interact with parents? Is the child age-appropriately responsive? Breathing patterns. Is breathing normal, labored, or noisy? Are there any concerning respiratory sounds? Skin color. Look for pallor, cyanosis, or jaundice. Assess for rashes or bruising. Pediatric vital signs overview. Vital signs in children differ significantly from adults. Key differences from adults. Children have higher heart rates. They have higher respiratory rates. They have lower blood pressure. The 6 vital signs we assess. Temperature. Heart rate or pulse. Respiratory rate. Blood pressure. Oxygen saturation. Pain level. Remember, always compare findings to age-appropriate normal ranges. Trends are often more important than single values. Temperature assessment. Temperature is often our first indicator of illness. Normal temperature ranges. Infants, 97.7 to 99.5 degrees Fahrenheit. Children, 98.1 to 99.9 degrees Fahrenheit. Methods based on age. Rectal temperature is most accurate for infants under 3 months. Axillary temperature is used for infants and young children. Oral temperature is used for children over 4 years. Tympanic temperature is less accurate in infants under 6 months. Important considerations. Fever in infants under 3 months requires immediate attention. Method selection depends on age and clinical situation. Heart rate assessment. Heart rate tells us about cardiovascular function and stress levels. Preferred assessment sites. Use apical pulse for infants and young children. Use radial pulse for children over 2 years. Normal heart rate ranges. Newborns, 100 to 180 beats per minute. Infants, 100 to 160 beats per minute. Toddlers, 90 to 140 beats per minute. School age, 75 to 118 beats per minute. Adolescents, 60 to 100 beats per minute. Assessment tips. Count for a full minute in infants. Note rhythm and quality, not just rate. Respiratory rate assessment. Respiratory assessment requires careful observation. Assessment techniques. Observe abdominal breathing in infants. Count for 1 full minute due to irregular patterns. Watch for chest and abdominal movements. Normal respiratory rates. Newborns, 30 to 60 breaths per minute. Infants, 30 to 50 breaths per minute. Toddlers, 25 to 40 breaths per minute. School age, 18 to 30 breaths per minute. Adolescents, 12 to 20 breaths per minute. Watch for signs of respiratory distress, nasal flaring or retractions, unusual breathing sounds. Blood pressure assessment. Blood pressure assessment requires proper technique in children. Correct cuff size is critical. The cuff should cover 2/3 of the upper arm. Too small gives falsely high readings. Too large gives falsely low readings. Measurement methods. Auscultatory method is manual and more accurate. Oscillometric method uses automatic devices and is quicker. Normal blood pressure ranges. Neonates, 60 to 90 over 20 to 60 millimeters of mercury. Infants, 87 to 105 over 53 to 66 millimeters of mercury. Toddlers, 95 to 105 over 53 to 66 millimeters of mercury. School age, 97 to 112 over 57 to 71 millimeters of mercury. Adolescents, 112 to 128 over 66 to 80 millimeters of mercury. Oxygen saturation assessment. Oxygen saturation helps us assess respiratory function. Normal range. Oxygen saturation should be 95% or higher. Assessment sites. Finger, toe, or foot in neonates. Ensure good perfusion at the site. Factors affecting readings. Cold extremities can affect accuracy. Movement can interfere with readings. Nail polish should be removed. Clinical significance. Low oxygen saturation may indicate respiratory distress. It can signal cyanotic heart defects. Always correlate with clinical appearance. Pain assessment. Pain assessment is vital for comfort and healing. Age-appropriate pain scales. For neonates and infants, use the FLAC scale. FLAC assesses face, legs, activity, cry, and consolability. For toddlers and preschoolers, use the Wong-Baker Faces pain scale. For school age and adolescents, use numeric or visual analog scales. Assessment principles. Believe the child's report of pain. Observe behavioral cues in nonverbal children. Assess pain regularly and after interventions. Head-to-toe physical assessment. A systematic approach ensures nothing is missed. Head and neck. Assess fontanelles in infants. Measure head circumference until age 2. Eyes. Check red reflex. Look for strabismus. Assess tracking ability. Ears. Check position and shape. Assess hearing responses. Nose and throat. Ensure nares are patent. Check oral mucosa hydration. Chest and lungs. Listen to breath sounds. Look for retractions. Assess symmetry. Abdomen. Listen for bowel sounds. Check for distension. Examine umbilicus in newborns. Extremities. Test reflexes. Assess muscle tone. Look for clubbing or cyanosis. Skin. Check for rashes or birthmarks. Assess skin turgor for hydration. Neurological assessment. Neurological assessment evaluates brain and nerve function. Components to assess. Level of consciousness: alert, drowsy, or lethargic. Reflexes: Moro, Babinski, and grasp reflexes in infants. Muscle tone, checking for hypotonia or hypertonia. Coordination in older children: walk, finger-to-nose test. Age considerations. Primitive reflexes are normal in newborns. These reflexes should disappear as the nervous system matures. Persistent primitive reflexes may indicate developmental concerns. Recognizing respiratory distress. Early recognition of respiratory distress saves lives. Early signs. Nasal flaring. Tachypnea or rapid breathing. Intercostal or subcostal retractions. Late signs. Grunting with breathing. Cyanosis or blue-tinged skin. Bradycardia or slow heart rate. Nursing actions. Position the child to maximize airway. Administer oxygen as needed. Notify the provider immediately. Prepare for possible intervention. Critical red flags. Some findings require immediate action. Temperature red flags. Fever over 100.4 degrees Fahrenheit in infants under 3 months. Heart rate red flags. Heart rate less than 80 or more than 220 beats per minute in infants. Respiratory red flags. Respiratory rate over 60 in newborns. Respiratory rate over 40 in older infants. Blood pressure red flags. Persistently low blood pressure. Difficulty obtaining blood pressure readings. Pain red flags. Severe pain not relieved with interventions. Pain accompanied by concerning symptoms. Creating a positive assessment experience. How we approach assessment affects the child's cooperation. Techniques for success. Engage the child through play. Use age-appropriate language. Explain what you're doing in simple terms. Involve caregivers throughout. Provide positive reinforcement. Allow the child some control when possible. Building trust. Be honest about uncomfortable procedures. Never use threats or deception. Respect the child's fears. Celebrate cooperation. Let's review the essentials of pediatric assessment. Key takeaways. Vital signs vary significantly by age, always compared to normal ranges. Pediatric assessment requires a gentle, non-threatening approach. Observation is a powerful assessment tool. Early recognition of abnormal findings prevents complications. Building rapport with children and families improves outcomes. Systematic assessment ensures comprehensive care. Thank you for watching. These assessment skills are fundamental to providing excellent pediatric nursing care.